everybody. Good morning. Welcome to class. My name is Eunice Mathis. I will be your instructor for today. You're attending the American Heart Association Basic Life Support Instructor course. And I'll tell you the differences between the two courses. When your students call you for a class, they don't know what type of CPR they need. So they're always going to use the very generic term, I need a CPR course. You have to be the one who's asking the questions as far as where are you working, are you going to nursing school, etc. Because there's a basic or a heart saver CPR course that's good for laypersons. Laypersons is someone who doesn't work in a medical facility, someone who's not a nurse, a doctor, or a CNA. They take a separate course than what your basic life support providers would take. Basic life support provider, the way I want you to think of it, is anyone who's going to be working as a team. So if you think about whenever there's a sitter in a home care setting, she's by herself. More than likely that sitter will only need heart saver CPR or basic CPR. But when she calls 911 and the paramedics come in, because they come in as a team, they have to have basic life support. And so that'll kind of help you, because if your students take the wrong course, not only will their schools or their workplaces not accept it, they're also going to want a refund. Okay, so you don't want to do that to your students. So welcome to class. Everyone's getting signed in. What we've not done is actually passed around the roster. So, and this is part of your classroom process also. Our rosters are pre-printed because when you use the classroom registration system, it collects your information, but I'll show you how to access your rosters, okay, that you can use in your classes, and those will be printed rosters. Very important, have all your students verify their name and their email address. If you can't read it and you misspell their name, each card has a charge attached to it, a fee. And so if you misspell the name, it's really hard for you to correct that, and you may have to pay for another card. Okay, so would you please go ahead and make sure your name and your email address are correct, and if so, sign where it says sign in. And I have provided pens, so I'll provide another one if you misplace it. Here you go. And then if you just keep circulating that. Yeah, definitely give me the gas line.
How do I get it?
See the little globe? It kind of looks like a globe down the right hand corner. Next to the I'll pass it while he's doing that.
Please go on.
Thank you.
Who is there today?
Thank you.
Is it the same guy as yesterday? Okay, you have another guy? Okay, let me take care of it.
All right, and so Nola, you may want to step out.
Me?
Yes, yes. And so is your name spelled correctly, and that's all
Yes.
signed for you? Yes. All right. I've seen it for well now, yeah.
We're both still on call today,
I
so.
know, so just step out and then, you can, because everyone's so busy.
Mhm.
And everyone's understaffed too, so it's a lot that we're dealing with right now. All right, so now that you all are signed in, tell me what made you decide to become an American Heart Association instructor? That's about who goes first.
Well, we tried, we are going to try to make, overall a business in Puerto Rico,
Very
for, different course.
So similar, and I know you all registered for the instructor development course, and we'll do that remotely. Because I want to make sure you finish your whole instructor process, and then we'll find an evening where we can just meet online, and then we'll make sure that because then you'll have more questions, because you'll see the layout of this building, and then you can ask those higher level questions. So congratulations in advance. And it's not that we're trying to open up a business, we're going to open up a business, right? So how do you know each other?
She's my wife.
Oh, that is so awesome. All right, so go team.
Yeah, we met 10 years ago.
That is amazing. All right, and so whose idea was it?
Well, we took, we tried to keep up with, many courses during our, I'm a paramedic and she's a nurse.
Okay.
So we try to keep up with the, any course that will improve our, skills. So we took a class, airway management.
Very good.
So, the center, the training center that we took the course in, was nice. He's a very skilled, instructor in many of the courses he gives. And we thought that maybe we could do it because where we live exactly, we live in the center of the island. And there's not many instructors there. We have to go to the city.
That's wonderful. And then you get the best of both worlds because you get the pre-hospital professionals, paramedics, firefighter, EMT, and then you get the CNAs, and nurses, and the doctors. So I expect big things from you too. Now, what about you? What made you decide to become an instructor?
I think just to make a difference. You know, it's really hard to get our whole facility through the courses in a timely manner. And when COVID hit and whatever so I've been there for 3 years. And so they have some other program set up that I'm not even familiar with. It's not AHA. So they were just training people like on site with a regular dummy, not like a feedback.
Yes.
And then COVID hit and the instructors started dropping off and then classes weren't being kept up with. So now a lot of our staff, we have like over 300 employees, are overdue. And because of the type of facility that we have, some of those are healthcare providers and a lot of them are not, like clinical staff, administrative staff, you know, things like that, who don't really understand
The importance of keeping up those credentials. Well, now they have you two on the team, you and Noel. So, I mean, you've been on the team, but now you have the power. So the process is 3 steps. You all completed step 1. You have your ticket to enter, your online courses. This is part 2. This is the live class, and I have bad news for you. This class does not teach you how to teach a class. This class teaches you policies and procedures. Part 3 is when you all will be back with me tomorrow, and then we'll get your classes set up. We have, I think, a class on Tuesday and Thursday of next week, so it just depends on how fast you want to get your instructor monitoring done. But you all will be co-teaching a class with me tomorrow. I start off, I lead, and then I gradually back away, and then you two will be ending up leading a class. And you do everything from the team components to child BLS, to infant BLS, to choking. And so we will start with a review of our skills today, just to make sure you're abreast of them before you actually do your monitoring session tomorrow. Noel, you're the last one. We just want to know what
I
prompted
apologize
you.
to everybody.
No apologies. Everybody's busy.
I had a security issue.
Just breathe. And so hopefully we're only gonna be here for about 4 to 5 hours.
But tell us why you're here, Noel.
That's where we at. Okay, I manage safety and security for my company, and part of my job is safety compliance, and we were having an issue with getting our employees certified, and we're about to maybe be out
Compliance, and
of
we don't want that,
compliance,
yes.
so I took it upon myself initially and to find someone else to initially be instructors and just get it going, and then get everybody certified, and hopefully get a couple of more instructors, which I already have identified, like 2 people who want to be instructors. So, but as a safety compliance manager, I have to, you know,
Yeah, we gotta be in
grab
compliance, not just OSHA, but patient safety. And so a lot of what you're doing, I told you all about the student that complained. I'd rather deal with a complaint than send an unsafe provider out. So I will deal with that complaint any day. So my focus is always on patient safety. And if you do what you're supposed to do, especially if you're entrepreneurial, because some people are doing this for their in-house training programs, and others are doing it as a business, regardless, patient safety. It's not about just giving people cards. If they don't understand the components of how quality BLS. If they can't pass the test, we will work with them, but we are not just giving cards away. So thank you all for being serious. You came, you're ready. And let's do a quick review. So on your tables, everybody, there should have been a white piece of paper that had some lines, and it said BLS notes. And if you want to put your computers away just temporarily, you can. To give you more room. And Elaine, if you want me to, I can put your computer over here. Do you have enough room over there?
Yeah.
Okay. All right. And so, a quick BLS review. Instructor candidates, I don't care how experienced the students say they are. Oh, I've been doing this for 20 years. Start your class off with a review. If you don't use it, you lose it. What does CPR stand for? Yes, and so cardio being the heart, because some students don't know that. I teach CNAs all day and I say, hey, when you're taking the pulse, what are you counting? And they'll say, breathing. So we want to make sure cardio, heart, pulmonary, lungs. In our class, we only simulate rescue breaths. I'm not sure how you all feel about COVID in your cities or what have you, but there is a rise. I went into a facility yesterday and there's a sign on the door saying the CDC recommends you don't come in here because we're having a COVID outbreak. And so there is no device right now where if you're using your mouth, that the filter is strong enough to prevent you from passing or contracting COVID. And so in our classes, we don't, and you decide what you're gonna do for your classes, but we don't breathe into the mannequins. Instead, we say the word breath and breath. So we just verbalize it versus physically doing it. Because in the real world, you gotta think about what's gonna happen to you. Speak to your risk management person. If you decide to give someone a breath and you contract COVID, or if the person had never been tested for COVID and you give them a breath and now they test positive, they can say that you did it and you increased your liabilities. That's not AHA talking, it's Eunice the nurse talking for anybody who's watching. So you always wanna be thinking about liabilities. Speaking of liabilities, there is, and I want you to write this down, there is insurance for CPR instructors. Do you know how many names my card is on? The insurance company is called Hiscox, Hiscox. It only costs his Hiscox. It might only cost about $20 a month, but that's something that I would recommend that you look into, especially if you're trying to be independent, you're teaching outside of a company, and if you're teaching inside of a company, you want to be asking, if they're going to be providing some type of insurance, okay, for you. So now that we've done that, we know what CPR stands for, and you promised me that you will not be kissing our mannequins or putting your mouth on our equipment. All right, so Milian, what does ROSC stand for?
Return of spontaneous circulation.
Yes, and so imagine someone who was just working at a restaurant yesterday, and now they want to go to nursing school. Well, they know what that means.
No.
So in parentheses, I have it written. What does that mean in layman's terms?
Go back to life.
And the heart start beating again, the pulse return. So whenever you're teaching your courses, we have the American Heart Association lingo so they can pass their tests. But I teach classes to a wide variety of people. I have to make sure my babies understand what we're talking about. So ROSC, return of spontaneous circulation, or in parentheses, it's on your paper, the pulse is returned. Okay, and that's the goal of high quality CLS. Lonnie, we will not have high quality BLS if you're not compressing deep enough. How deeply do you compress for an adult?
2.5 inches in their chest.
And so if you look at your paper, 2.5, I know we just want to round it up. American Heart Association would say that's the incorrect answer. So look on your paper and give me the number exactly that's on your paper. That's right here. So look right here. Compression depth. I'm looking upside down.
Oh, okay.
2 to 2.4. So yes, a student, if they choose 2.5 inches on the test, they're going to get that answer wrong. So you as an instructor have to know like these exact numbers. When in doubt, go back to your book. If it's something that your book doesn't answer or doesn't address, I am so good at giving people homework. Imagine how many people who come in who are smarter than me or who think they're smarter than me. So when they start asking me all those questions, I'm like, that is a very good question. Please go look it up and tell me what you find. I know a lot, but I can't know everything. All right, so no L. 2 to 2.4 inches. If I'm on top of someone's chest, that's hard to calculate. Can you give me a fraction instead? The side view of the chest, how deeply do we compress that side view? And you can look down, it's on your paper. So give me the fraction instead of the
No,
inches.
1/3.
1/3, so it's either gonna ask you inches or it's gonna ask you the fraction. So for all sizes, all ages, bring that side view of the chest a third of the way in. That becomes really important when you're dealing with bariatric patients, larger patients. You can't be compressing 2 inches and be effective. How fast do you compress? How many compressions per minute, Cassie?
100 to 100.
Yes, yes. I love her. She looked down. She knew it, but it's like, you know what? I'm gonna look down for confirmation. Minimizing interruptions. How many seconds max do you have? 10 seconds, okay. So, this is a hard one. You're by yourself and your patient who's in cardiac arrest vomits. What do? Do you focus on compressions or do you focus on turning them on their side and giving those breaths?
You're alone.
You're alone.
I just do chest compression.
Yes, that is the correct answer. So your priority is CAB, not ABC. ABC is when they're still alive. They could be circling the drain, blood pressure's lowering, respiratory rate too. But we're focusing on ABC until they go into cardiac arrest. Once they're in cardiac arrest, we need to focus on circulation. There's still some residual oxygen in the bloodstream, and we have to get on that chest and start doing compressions to make sure the oxygen actually circulates. What organs are we saving? The main organs.
Brain,
Okay, perfect.
heart,
Heart, and let's get some blood flowing.
the lung.
The lungs. Anything else is kind of, optional. Kidneys probably didn't work too well anyway. But yes, let's try to keep that blood circulating, so minimize interruptions. And if there is something in the person's airway, either when your team arrives, they can address it, or once we have ROSC, then we can intubate and whatever else. The way I want you to think about it is that pneumonia is a disease of the living. So right now, if this person has vomitus in their lungs, we can't focus on that too much right now until we have a team. What we can focus on as an individual is just those high quality chest compressions and minimizing interruptions. Cassie, chest recoil. What does that mean?
The chest fully rises back to its natural state.
What happens internally?
The lungs fill, the heart fills back up.
Yes. So your students who are going super, super fast and they're on that chest, on that chest, on that chest, they're not letting the chest rebound or recoil. And because they're not allowing that, the heart's never refilling with blood. So that rescuer is going to be tired, but they're not going to be effective. Which is why the American Heart Association requires that your mannequins have feedback devices. And the 2 feedback devices that your mannequins must have are compression depth. So usually when you press down, you're going to hear a click. And then as far as the rate, if you get the Preston mannequins, it's going to have lights in the shoulder and the light should be flashing. And that's also how you can be an unbiased educator. Because I can't be pointing you and say, hey, you're not doing your job. The mannequin is also reminding the student because you want to be letting them know about the feedback devices so they can also be monitoring their CPR quality. Okay. What questions do you have before we go any further? Let's talk about trach and intubated patients. If a patient has a trach or an advanced airway, we don't stop to give breaths. CPR is continuous. How frequently do we give a rescue breath? Every 6 seconds for an adult. What if it's a child or an infant?
Every 3 seconds.
Every 3 seconds, every 2 to 3 seconds, that's perfect. So if you think about the cause of a pediatric arrest, more than likely it was respiratory, and they already breathe faster than us. So if we're gonna be supplementing or managing their airway, we're pretty much give a breath, release, give a breath, release. You're giving a breath about every 2 seconds. You give twice as many breaths to a pediatric. The AED, what does it stand for, Noel?
Automatic, external, I had found the middle word.
I'm usually gonna say automatic electrical.
No.
And so that's pretty much the same thing. External, because we're using those pads. People have internal or implanted pacemakers and defibrillators. Can you use an AED if a person has an implanted device?
Yes.
Yes, you can. You just can't do what? Put the pad over that area. So can you use the AED on a pregnant mother? Yes, you can be entering the medical field. They think that doing chest compressions deeply enough is going to cause pain to the person. Oh, if I crack their ribs, I need you to really emphasize that we can fix ribs and the pain caused by having a broken rib with time. But if they don't compress deeply enough, what happens to the person's brain? So we can't reverse that. So same thing with using the AED on the mom. They're like, oh, I'm gonna cause injury to the baby. Mom's heart is stopped. That has caused injury to the baby. I need you to use the device in order to restart mom's heart. Noelle, what does that shock that the AED delivers, what does it do to the heart's rhythm?
It tries to regulate it.
I think you all wanna write that down. I heard Noelle say that the AED normalizes an abnormal heart rhythm. That's what I heard him say. Write down the note. The AED normalizes an abnormal heart rhythm. So we want to get that to the scene fast. And I'll repeat it one more time. The AED normalizes an abnormal heart rhythm. So this is how I start off my classes. We do safety, I show them the layout, let them know where the restroom is, give them an opportunity to use the restroom because most of them have been traveling before they get to us and now they're here and they have anxiety. Your job is to calm them down, get them signed in, and do a quick review before you press play on the video. For the instructor course, we're not going to be pressing play on the video right now. I want to talk about 2 more things, and then we're actually going to do our skills practice before you get to take your provider test. And so as an instructor, you have to take 2 examinations. The first test you take is the same test that the students would take. And for American Heart Association, we don't use the term student, we use the term provider. So it's kind of like strange, we keep saying provider. But just when you hear that, just automatically think student. So you have to take the student exam. What is the passing score for a student taking the BLS test? 84. But for an instructor, it is 90%. So pretty much all you can miss is 2 questions. And I'm okay with that because now you get to know how your students feel, and if you're not successful, you get to remediate. And so I don't fail people, I allow them an opportunity to retest. That's how you have to put it. All right, so you've earned an opportunity to retest, and that way you don't feel bad about it, because at the end of the day, more than likely, the person who may have testing anxiety, that person has worked a double shift. They just got off of work, can't go back to work because their CPR card has expired, and I am not going to stand between someone who was able to do their skills, but who may not be able to pass the test on the first attempt. My job is to help them be successful. And sometimes we have to do oral examinations. That means we're reading the questions to the person, but that's the last person we're going to see. Please remind me to issue you all Spanish tests, because in our area, we don't issue a whole bunch of Spanish tests. Not for your instructor class, but for your students. So once you complete the process tomorrow, your part 3, whenever I issue your exams to you, I have to also issue you the Spanish exams, the Spanish version. Okay.
I know it sucks in the Spanish version.
I would not be able to translate it, so that's why I don't offer it here. Because as the instructor, I have to be able to read it. Yeah, and if a student has a question, I will speak Spanish. So here I only offer the classes in English. Okay? But we do have requests for Spanish instructors. All right, so that was one of the things I need to talk about was the actual test. And then, yes, sir.
Is there any additional requirement for the Spanish instructor?
No, they do the same process you did, except for when they come to our
And the
class.
material is available in
Yes,
Spanish?
it is. Yes, it is.
That's something.
We certainly will. And so put that, I call it a bus stop. Anytime there's something you think of, just write it on a piece of paper, and then at the end of the class, or when the camera goes off, we'll visit the bus stop. Okay. Agonal breaths. What is an agonal breath? What is it a precursor of? He's dying. So if someone has an irregular you said it so sweetly. He's dying. So because your students were trained by you, when they see that normal breath that's not, doesn't have a pattern to it, they know they have to start CPR. Anytime when you're taking your test, if it says unconscious, unresponsive, anything in relation to a choking victim, put them on the ground, what do? CPR. So don't get tricked. We're not doing abdominal thrust or anything once they become unresponsive. We are going to help save their lives and do CPR. else did I have? It was one more thing. We talked about the provider's test, the instructor test. What is passing for your instructor examination?
90. What did you say?
So that was for the student level, the provider test. For the instructor test, because you have two tests, your instructor test passing is 84%. And I want to warn you that only about 50% of our instructor candidates pass the instructor test on the first attempt. So if you're used to making 100 on everything, just go ahead and get over it. It's not going to happen on the instructor test. What does it mean passing the open resource? American Heart Association exams are open resource. What does that mean?
You can use your books, you just can't communicate with each other. Books and notes are okay, communication with each other is not.
So everyone has smart devices. As an instructor, think about security. As an instructor, we said you can use your ebooks. You want to make sure that you're actually walking around and looking at your students' phones because they can actually be on Google, and in order to keep your, and they can't. It's supposed to be American Heart Association resources. If they write it, they can use it. If it's the American Heart Association resources on their phone, they can use that. But then you also want to be mindful of people hovering their phones over the test, looking at it a lot, because we have to keep our exam secure. So, all right, everybody, let's get you to stand. And when you stand, if I could, yeah, you're perfect. Let's get you to stand. If you can move your items down a little. All right, so what I'm making sure is that you have a space for your mannequin. I probably did that wrong. Instead of you coming this way, Noelle, go to your mannequin. That thing better be a little bit easier. And so if you put your items in your chairs, then I'll bring you to mannequins.
How about back here since maybe it's back?
All right, everybody, and so you all promised me that you would not put your mouths on our mannequins. We're only going to simulate reps, and let's also talk about the height of these tables. For classroom purposes, these are not tables. These are simulated medical beds. These are your hospital beds. You're EMT paramedics, so more than likely you would be outside on the ground. You have to know where your students are going to be working at. And so if most of your students are caregivers who are going to be performing CPR on the floors, whenever you are in your class, you can have them demonstrate CPR on the floor. My classes tend to be a lot of in-facility providers who will be working on an elevated surface. Meaning that if a patient does go into cardiac arrest in the hospital setting on the floor, we may start CPR on the floor, but we're getting them to an elevated surface because eventually we have, the slower you all go and the less interactive. All right, so seeing is safe, and now we have all right, and so now you have to do your BLS assessment or your BLS survey. What two things do you check simultaneously? Pulse and breath. So let's see you do it. And so what is the name of the pulse in the neck? Carotid. All right, and so you want to be using those terms for your students. Remember, not all of our students are no breathing, there was no pulse. You want to be careful using doing this, because for someone else, what does it look like you're doing to your choking? So on the side nearest you, there we go. Stop choking our mannequins. All right, and so
It really
now,
doesn't matter which side?
so that your arm isn't crossing over, it's easier if you do it on the side nearest you, so you can see the chest rise. All right, and so how many seconds max do you have to do this? 10 seconds. I want you to point to me and say, hey, bring me the AED. Hey,
Bring me the AED.
And so when you're going to these different companies and you're training at their different work sites, you want to be asking questions. I usually go ahead and ask about their AED before AED they have, or you can go ahead and anytime you're including something that is not AHA, can you do it during your AHA course? Think about it, because that may be on your test. No. So if the safety manager needs to speak, they can add that before the course or after the course, but during your course, it should be strictly your content. So if I'm going to be showing them how to work their AED, I'll have to do that before or after, okay? Because usually I'm going to show a whole different video. So it's like, okay, we're going to go through with our training device, but at the end, I'm going to show you how to work your company's AED. Something else that's significant about that is usually when I go to companies, their AED is not near their first aid kit. So it is your job, because you are trying to make sure that if there is an emergency at that location, that you don't have people running in 3 different directions. They need to get everything closer. And then I go to different offices and they'll be like, oh, the nurse has the key. I'm like, what if it's the nurse who's in cardiac arrest? So we need multiple people knowing how to get the things and get everything closer together. So everybody look left and look right. Seen is safe, tap and shout, wake them up.
Fred,
All right, check for breathing, check for a pulse. Good. She's calling for help. Noel's still choking his patient. It's okay. All right, we're gonna go get the AED. Awesome. And now, your patient was breathing.
Oh.
So what would be the reason the person is unconscious but still alive?
Porque va a estar inconsciente y se come. Or it can be an overdose, it can be a
Yes.
low blood sugar.
Perfect. So look at you, you're doing your full assessment. I need you to make sure your students understand that too. Because for classroom purposes, they just assume everybody gets CPR. Because someone's blood sugar is low, they're still breathing, they're not responding to you. They don't need CPR. You need to go get that nurse. Go get someone who's higher than you. And if you're not in a facility that has a nurse, you can call them 911. Okay? And you monitor them. What is the recovery position? On their side. Why do we place them on their side? So in case they vomit. If they vomit and they're on their side, the vomit should come out of their mouth, preferably the left side down. Because if the vomit doesn't all come out, and it goes back down, it goes into the stomach. That's if that's an option. But not everybody's going to need CPR, and your students should be aware of that too. Okay, awesome. So tap and shout one more time for me.
Fred, are you okay?
No response, no response. I'm calling 911. They're asking what's the emergency. I want you to say there's no breathing, there's no pulse.
There's no breathing, no pulse.
All right, and so now one's gonna ask, do you know CPR? And you're gonna say yes. So get those medicines closer to you. All right. And so if we have to put you to the floor, we will. Otherwise, I'm gonna hold on to this table and you're gonna have to jump on top of the table. I'm just joking. You're gonna tip your toe. Because she wasn't like she was gonna do it. All right, so everybody be careful with having those stools. Because I used to have stools back in the day, and what I found was that the stools were helpful for compressions, but whenever they went to go give their breaths, they would topple. Okay. So I don't have stools in my class for that reason. All right, so hand placement. We don't have the little rib cage area on the mannequins where you do your measurements. That's old school. Just pretend you have perfect nipple line. Don't press on the throat. Don't press on the xiphoid process. Go in the center of their chest and press down 2 inches until you hear a click. Great. All right, so slow down. Oh, y'all are ready. I love it. All right, so, and so what did you see in the shoulder? That green powder. Yours, it clicked. I think it was just the sound. Yep, because your light's on. That's not the click. All right, so red means dead, everybody. The goal with the lights would be to get 2 green lights. If you get 2 green lights and an orange one is flashing really fast, that means you're not allowing chest recoil. That is a warning for you to slow it down. All right, hands on the chest. It's for 30 compressions. Let's go. 1, 2, 3, 4. Oh, that's start all over again. That's start all over again. Pause. Because you all have to count. How will I know if you're not counting? So everyone has to count. Yes. And so the reason why you're counting out loud is because you call for help. And when the help comes, they're going to need to know what number you're on. How do they know when to switch out or anything? Yes, Noel?
We'll know if we're doing it correctly with 2 green lights.
2 green
That's
lights, yes. And if you get 2 green lights, it would not even recognize the rate if it didn't know you were compressing. So you're getting deep enough whenever you see the colors. Everybody, hands on the chest. All right, and you're going to count for me, so let's go. 1, 2, 3, 4, 5. Don't go too fast. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right, that's gone. You have 10 seconds to give 2 breaths. All right, so let's actually want to do this. So mask on. I want to see you do head tilt chin lift because at some point we may have max immunity. The COVID won't be a thing anymore. All right, so mask on. All right, and so I'm going to help you here. So it's going to look like this and this. Head tilt chin lift. And so you stay right here to the side. This is all you're going to do, right from the side. Because remember, you only have 10 seconds. Everybody bend down and say the word breath. So you got to make a tight seal. So here and here, these 3 fingers lift. All right, so breath, breath, and breath. And so I really need you to bend down. Gotta bend down. When I say simulate, we're just pretending, but we're doing it. Yes, sir.
Are we, we gotta go over again the C plan?
But that's with a different device.
Oh,
So,
okay.
yeah, so
Okay.
right now, I don't have that.
Great,
Only I'm going for the bag.
Yeah, great.
This is, you're in Eunice's nursing home, and this is all the equipment I have in my first aid kit, okay? So, somebody, the AD person, hasn't even come back yet, so we just got the first aid kit. All right, so mask down, otherwise it's going to fall. Now, I need 4 more cycles. Let's go. 30 compressions followed by 2 breaths. 1, 2, 3, 4, 5, 6. Come on, get it together, count together, team. 13, 14, 15, 16, 17. Arms Noel. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head, 10 lift, 2 breaths. Breath. 1 and 2. Great job within 10 seconds. So back on that. That's your time. That's it. So let's go. 2, 3, 4, 5, 6, 7. Going down. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Breath and breath. 9. You only have 10 seconds. Breath. Good job.
Breath.
I have 3 cycles left. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Breath and breath. And I think that's it. You have 1 cycle left. I know you need CPR. Let's go. 1, 2, 3, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Breath and breath.
Breath.
All right. Whew. So, Noel, do you mind practicing the cycle on the floor? Because when you're teaching your course, more than likely you're gonna get it.
Yeah, I will.
Okay. So, I do apologize, I don't have any knee padding, ladies. You are welcome to have a seat. Unless you just want to practice on the
Just
floor.
directly on the floor?
Directly on the floor. Noel's gonna take on for the team for all the ladies, okay? She's like, okay, not a problem. All right, and so, good. Just put it on the floor too, because we're only simulating. And so, with your bottom facing that wall, and so whenever I have women in the class, because sometimes they don't dress appropriately for CPR classes, I usually have their bottoms facing the wall. All right, and so, and I know it's painful, so we don't keep them on the floor for too long. Hands in the center of the chest, all right? And let's go straight down. And watch out for your thumb. You see where your thumb is placed at? It's on top of the xiphoid process, so you want to move your hand up a little more. There we go. Avoid the xiphoid process. Let's go. 30 compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22,
23,
23.
24, 25, 26, 27, 28, 29. One more cycle. Good job. 1 and 2. All right, one more time.
1, 2, 3, 4, 5,
6,
6,
7, 8. Encourage them, everybody.
11,
Count for 'em.
13, 14, 15.
Your team is not counting, Noel. 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Great job, Noel. Okay, so when you're teaching your class, Noel, you may want to have some type of padding or let them know that on the day of the class to bring a jacket or something for their needs. It's
Oh,
one.
yeah, I already considered where I'm
Okay.
gonna go.
Very good.
We're gonna-
Yes, you can build it up for safety. So whenever, I'm going to build it up. So whenever you're having things out in your room, always think about safety and what's gonna be a fall hazard. So if we put it down, we're gonna pick it out. And I'll pass it on to sanitizer. Does anyone need a bottle of water? The bag mask devices. Once we have the bag mask device, the letters right, so everyone is the EC clamp technique.
What's it called?
EC clamp technique. I'm sorry. No, it's fine. You do your letters, that's all that matters. I know if there's an emergency, you will get
EC clamp.
EC clamp technique. So the 3 remaining fingers form an E, and that's what we're gonna use to tilt the chin up. And so it's gonna look like this.
What is this device?
The bag mask device. A term you may hear in the real world is ambu bag. But the American Heart Association does not use brand names. It is a bag mask device. because Johnson & Johnson may make one. And y'all be like, he'll get me the Johnson & Johnson. All right, bridge of the nose. Okay. EC. Right now the tongue's blocking the airway, what do I need to do? Proper class preparation is one of their topics. Was it you, Noel? Yeah, because I didn't check. And so you always want to test your equipment, your batteries and your lungs before your class starts. Oh, good, it worked for me. Have people do is to hold the mask with their non-dominant hand.
Not in chest inflate if the batteries are,
Two separate components. So the
Okay.
batteries only deal with the
Check.
flashing lights, and then the lungs, probably during our actual monitoring session, is when I'll have you practice with your lungs if you don't have your equipment yet, so you'll know how to put a lung in the mannequin. So this plastic is the lung, and that's what makes the chest rise and fall. It's like a balloon that's in place. So if I can get you two at this station, and then Noel, if I can get you to run your mannequin down, and then you and Cassie will be at this station. And then let me just test your mannequin. Come on down. And you don't have to do too much movement, Noel. It's just. Okay, everything works. All right, so mask in place. All right. Come on down. You're gonna be right there. So did you get chest rise and fall? And you may have to use your body. And so that you're, there we go, and eat, and now use your leg if you need to, because you're gonna be here for a good little while, and get past feeds in that bag. And where do you feel air escaping from?
Here.
Okay, so let's put it tight on the nose, press down first. All right, 3 fingers, use your leg to keep that airway open, so bring this leg, your left leg.
Playing that tune.
I know, let me try to do not disturb. Okay. All right, so did everyone get chest rise and fall yet? All right, so now switch out, let your partner practice. All right, and remember, it should be an EC, because we can't tell students to do something if we're doing something different, and because respiratory therapist is usually here, so just. Good. All right, we got it? All right, so airway person, stay in place. Compressors, hands on the chest. After 30 compressions, your partner's going to give 2 breaths. When you get to your 30th compression, you hover. Your hands come up so they can see if the chest rises and falls. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Don't go too fast. 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Hover, and 2 breaths. 1 and 2. Let's repeat it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Great job, everybody. 1, 22, 23, 24, 25, 26, 27, 28, 29, 30. And hover. And we're going to say that at the end of 2 minutes, you all have 10 seconds to switch. Switch carefully. 9, 8, 7. Compressor, get on that chest while the airway person does their thing. Let's go, compressor.
1, 2, 3, 4,
5. Pick your front table. 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. 1 and 2. Get back on that chest. Open up the airway. You can reposition if you need to. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right, and for classroom purposes, we're going to stop right there. Great job. All right, and you all can have a seat. Does everybody know how to work the bag mask device? All right, so the last piece of equipment we have to show you how to work before you take your exam is going to be the AED. Whenever you purchase your mannequins, they will let you know what type of solution to use in order to clean your mannequins. We're using Clorox wipes now. When I use the 10% bleach solution, if you're not too careful, it's gonna leave a lot of residue. So I've been using the wipes because the wipes have been, the current wipes kill COVID-19. So just make sure if there's ever a COVID-20 or a COVID-2021, you have to make sure that whatever you're using
There's no manual.
is going to kill that particular germ. The AED. When it comes to the scene, what is the first thing you do? When it arrives, what do you do first?
Turn
Turn it on, okay? And so that's the automated part. And then after that, to help your students pass their exams, they always want to shock. We don't know if a shock is even needed. After powering it on, you want to listen, you want to follow the prompts. It's going to talk to you. Is this a good review for you all? Well, at least one person likes me. He said yeah. All right, and so whenever you're doing your global demonstration, you want to make sure all your students see the device. So you're just not going to be looking at it because a lot of us want to teach to ourselves. You have a classroom full of students. And so if you have multiple AEDs, perfect, but I know everyone has a budget. So at least 1 or 2 AEDs for a class of 6. And then you're going to power it on. Notice I haven't turned it on yet because I don't want to talk over it just yet. It's going to overpower my voice. Once you turn this one on, it is going to say apply the pads. Your students will need to know what the pads look like. Don't assume everyone knows. And so these are, for our simulation purposes, these are adult pads, and it has an image that shows you the pad placement. One of the reasons why women are more likely to die from sudden cardiac arrest than men, especially if it happens outside of a hospital environment, is because people don't want to expose a woman's chest. And so they do now have mannequins that have female breasts. That is something you may want to consider. I just explained to everybody, if you want to save a woman's life, at least start doing compressions on the clothing, and then whenever a female rescuer comes, if you don't want to expose the chest because you're thinking you could be sued, then have that female expose the chest. But if no one exposes the chest, we're delaying the use of the AED, and we're giving that woman a lesser chance at survival. All right, so pad placement. Because I can have 6 people in the room, I'm just not gonna be like, oh, this is how you place the pads. I trust but verify. Everybody on your own bodies, show me the pad placement. High right, low left. And so switch it, so that's your, so right.
High right. High right.
Right hand over your right.
Derecho alta.
There we go. And yes. And so very good. The low left, perfect. High right, perfect. When your students, when they think of left, they usually place the pad on the stomach. The apex of the heart is where the crease of the breast line is. That's where the strongest part of the heart is. So you don't want them putting the pad down here. If the pads are going to be sandwiched in the heart, it is high right, low left, and they won't have a bra on. That bra has to be removed. Nothing should be touching the pads. Right, so you're welcome to just keep a seat right there. So we talk through this. May I actually stand up? We'll stand up. And just get you stand right there. That way everyone can see. AED arrived to the scene. What's the first thing I do? And then I listen.
Apply pads.
It says to apply pads.
Near chest. Plug in pads connector next to flashing
We
light.
don't peel and stick in our classes, but you're welcome to peel and stick. We just place, okay? In the real world,
Apply pads. Plug in connector.
where do I connect it at? Where it's flashing. So you want to slow down so your students see that.
Analyzing heart rhythm.
If she's touching, what do I say?
Do not touch the patient.
Clear. No one should be touching when it's analyzing. This is when it gets tricky.
Shock advised.
You go do some compressions. Go ahead and compress for me. Right now,
Charging.
compress. Go ahead and compress. Trust me.
Keep
Keep going.
Clear shock.
Everybody clear?
Press the orange button now.
We're gonna press this orange button.
Shock delivered.
We're doing compressions. Perfect.
Begin CPR.
1, 2, 3, 4, 5, 6, 7, 8. Great job. You can stop. Applause, everybody. So prior to the metronome, she was pressing faster, the orange light was showing. What is the purpose of the metronome?
To keep you honest.
To keep pace. And all AEDs that correspond with American Heart Association guidelines should have this tone. How frequently does the AED reanalyze? Every 2 minutes. How often should your compressor switch out? Every 2 minutes. So every time this machine reanalyzes, that should be a prompt for your compressor to switch out. Now I'm gonna say something. I want you to say this in your classes too. For classroom purposes only, I'm turning off my AED. Someone say it for me.
For classroom purposes only, I'm turning off my AED.
Because imagine what a student's gonna do in the real world. Guess what? We shot once, and guess what we do?
Turn it off.
Turn it off. No, for classroom purposes only, I'm turning off the AED. You will not turn off your AED until the paramedics arrive, or if you're in the hospital, until we figure out the cause of this person's arrest. So what you do, your students will mimic everything you do, and you always want to make sure that you're being a good model. So, what questions do you have about the use of the AED? We, as BLS instructors, have to use the AED as if it's a manual defibrillator, whether you've ever used a manual defibrillator or not. Think about the old days when they had the paddles. If you're teaching a warehouse worker, they're to use this AED exactly as stated. Once it analyzes, no one touches again until we fire the shock. But for basic life support providers, the time when the machine is just charging, it's just sending energy towards the pads, we don't want to just stand there and do nothing. So when it's charging, what do? Keep compressing. So that means that the person who's working the AED has to clear twice. They clear when it's analyzing, and then they clear before they press this button, okay? Your staff that are not nurses will work the AED the way the machine says to work it. Your staff who are nurses should be doing compressions when it's charging. Do you all understand? Okay, all right. Did you have a question? I interrupted you.
No, it's just, we usually in the ambulance back home,
Mhm.
we have these, we connect them to the monitor.
Okay,
So, but she doesn't, I believe.
and so
So
that's,
he only has the board, right?
You're on the paddle. And so on the floors in the hospital, we usually have the manual defibrillator, and then in the lobby areas, we have the AED. So, but the American Heart Association has us using the AED because we don't know where you're going to be working. But if you do work on a floor that has a manual defibrillator and it's part of your job, the job will show you how to work that device. We have an ACLS class for that, okay? So for your classes, basic life support, this is all we utilize. Yes,
It's
sir.
more, maybe the word is not more advanced, that have monitors, AEDs. Do they administer the shock within a time frame? It's always manual?
It's always manual because,
Just checking.
because what happens
Never
if the
used
scene
one.
isn't safe?
Then you shock them.
You shock your coworker. If you shock me, what happens to me? I
I
go, and we're already short staffed, I'm dead, no. So it's not an automatic discharge, it always takes a human to press that button, okay? Does anyone need a break before you take your first test? Great job, everybody. Alright, so what's the passing score? That's for the instructor test or the provider test?
84.
84%. Oh, I'm sorry, you all are correct. You all corrected me. It is 90%. Smart students.
Yes, because we're supposed to be smarter than the students.
That's right.
So which one are we taking now?
We're taking the provider or the student level test. So the student, if it was an actual student taking that test, they would have to make a score of 84% to pass. But for an instructor, we have to make a score of 90. And I have bad news for you. I do not allow you to use your books or your notes because we have done an hour review. We have practiced, we have talked. I need for you all to show me what you know. Any last questions before I pass out your exams? No testing anxiety, that's right. Inhale, exhale. And this is the last caveat I'm going to tell you. I only give you a minute per question. What I find is that if students don't know it, they don't know it. So we're not going to spend 2 hours taking the 25-question test. We have done a review. Your students will have done a review, watched the entire video, asked questions, been in class for 2 hours. No, you don't get an hour to take a 25-question test. Either you know it or you don't. So 1 minute per question. When I pass out your test packets, the sheets are laminated, so you can't write on them. That is something I recommend too. It's usually the nurses, they always write on it. You be like, don't write on it, and they write on it anyway. It's never not been a nurse who didn't write on the test, so, I have my sheets laminated. Once, and then your exam version, when you have your BLS exams issued to you as instructors, it's gonna have two versions, exam, A and B. I usually use B for those who were not able to pass the test in our actual class. So let's say I gave you 2 opportunities to take your test and you were unsuccessful. When you go home and study and come back, you don't get exam A again, you get the second exam. Your students have up to 30 days to complete their course. So if they couldn't do their skills, they come back and they do their skills. If they couldn't pass the multiple choice examination, they come back and pass it, okay? Please give your students an opportunity, because we know how hard it is to be a healthcare provider, work, have kids, and think.
Can you ever have them repeat one or the other on the same day, or do they have to leave remediate and come back?
My time, I find if they don't know it, they don't know it, and I don't want them getting frustrated with me. I want them to go home and study, give them some rest.
Got it.
I say they've reached the capacity of their learning ability at that moment.
Should we start?
Yes, you all can go ahead and start. In 25 minutes to start it, please put your name. Today is December the 2nd, and your exam version is whatever letters on your test, and I think it's exam A. You can do a mix in your classes, especially if you have people sharing the table.
She has a question and I messed up my paper. I'm answering the same.
So if you, the one that's incorrect, put one line through it and then put your initial. It's
Can I ask her what Ron's name?
Fonts is talking to you.
Oh,
Okay.
number, not the,
Don't change
the
that
answer.
masters, that means that this is a student's area. Right now, you're working as an instructor, so you
I'll
only.
circle the number that's the correct answer. I just repeat, like,
Nothing's wrong with that.
it's just part of my habit, like in
She's still
security.
testing, so we need you to grade your test.
Okay.
I got a question. Like, the AED, detects the ventricular unit, so that's
The irregular heart rhythm and the AED detects.
yeah, and then they're going to set the, it's going to set to check the rhythm. So with the patient, we'll just put under the AED comes.
How do you know it's going to say that it will show you?
Because it's a ventricular fibrillation, it's a shock rhythm.
Pass or attached. The AED, no text, what is the next step to use an AED?
So,
What are you going to select? Because I gave you the answer, it's okay, if you want wrong, it's okay.
I just follow the instructions.
Okay, follow the instructions, that's the correct answer.
Did I already take this test?
You did,
And how,
you did, you took this test before, so you earned yourself an opportunity to remediate, so let's go ahead and give you a new one. Just got a lot going on. Would you please show her grade, her test quiz while we're with Noel? So we do a lot of peer-to-peer, and there's a red pen.
As an instructor, please write your test up here.
And now you want to circle the corresponding numbers that were missed. Okay, so now you're no longer working as an instructor, now you're a student. And so this is something I would say to the student. I would say, you can use your previous test as a guide, so you don't change, so you don't use the same answer twice. But only go back and retest and answer the ones that are circled. Please put your name, today's date, and the exam version. So you only answer the ones that are circled. And good luck.
I'm sorry.
You get to point minus one. You get one. Así es, así enfrentarle.
Luego,
Abajo. 46%. Abajo de uno.
Awesome. So for the one that you answered correctly,
No, she has one that explains why that.
Okay.
No, why, you know, the correct answer.
I'm sorry.
I thought you thought it was. Okay, so let me show you the answers.
That's the main thing.
none?
No.
So minus 0,
What do I write here?
minus 0, that's how many you missed. That means your overall score is 100%.
So do I write 100%?
So every time you're grading someone's test, we need to know how many they missed and what their overall score of correct answers were.
Congratulations, everybody. You passed the first
Thank
round of
you.
Jumanji. Woo! All right, so. Woo, you did it. It only gets more challenging from here, but you're a teammate and you can do this. So tell me something you learned about the instruction process. Everyone has to give me a takeaway.
Or at least on the exams, there's always a better answer.
Right, so this exam could be challenging.
Yes.
And so how would you comfort, or how would you help support a student? So did I make you feel lesser than or intimidated when it was time for you to retake your test?
No, but at least the process lets you see what you originally thought was your choice, and then you'll notice, you know what, there is a better answer, or a better correct answer, if that makes sense.
Yes, there is. All right, so great job. Please give me a takeaway.
I find it tricky that I always do it. Whenever I take the courses, I always find that they're tricky. Like they want you to fall for the closest answer, but then you have to slowly read
Yes.
so you know what you're because yeah.
And don't
That's what
second guess
happened.
yourself. Don't second guess yourself. So you all did very well. What about you, Cassie? What have you learned about the instructor process?
I agree with all that. Being a nurse, you learn like through the NCLEX that they give you an answer that looks right, and if you don't read it all, you can get something that looks right, but there's the best answer, the right answer, and then there's the answer that looks like it's supposed to be the right answer.
You all, they got very smart people helping to write these tests.
I just did my renewal course in October, so it's still very fresh in my mind. Normally I'm kind of a slower reader, and it takes me a minute to process because I know I'm gonna trick myself in this. And so having that, like you giving us 25 minutes, and I was like, oh, 25 minutes, we're gonna read.
But
But
yeah,
I'm
when we
really
did
fresh.
like a full read, like we did, like pretty much everything except for infant. You went through almost everything before you took your test. Yes, sir.
It's not on a negative note, but this test gives you quite a little more questions regarding infants, and we didn't really go over it.
But as an instructor, what did
You
you?
know,
have to-
I'm just saying, like, we've gone over adults, and then we didn't touch at least something about infants.
Because
But
all
then
of
you
you
have to
all
remember
had what type of card before you came here?
an adult,
Child and infant.
or child and infant.
Yeah, so when you took your basic life support course, you covered all this stuff.
Yes, we did.
And so, as an instructor, I can't do everything for my students, but I can give them a good foundation, okay? Because some of them, especially when we're dealing with our nurses, our nursing students, when you go to nursing school for 4 years, you have probably 30 books and they're all like super big, and you take a test that has 75 questions. And the first thing they say is, I didn't learn that in school.
Yeah.
You have to learn some concepts, and then you wanna make your students accountable and responsible for some of this knowledge. Otherwise, Noel, you're gonna be drained if you have to tell a student every answer twice. So you don't wanna do that. All right, so would you please, Noel, put your papers in your clipboard, your little, paper clip? And you all deserve the first break. See you all in about 10 minutes. Get out, get some fresh air. Get some fresh air.